Hello and welcome to the third in a series of videos to help you answer the questions in the Care Certificate workbooks. My name is Daniel Dutton and I run the website dsdweb.co.uk, which provides free help, guidance and support for people that are studying for care qualifications. In this video we will be looking at Standard 3, Duty of Care. This standard examines what is duty of care, dilemmas that can arise between duty of care and an individual's rights, managing complaints and dealing with incidents, accidents and confrontations. For further information about this standard, visit dsdweb.co.uk by clicking the link in the description. But before we go on, I'd be very grateful if you could click the thumbs up button to let me know that you like the video, and subscribe to my channel by clicking the subscribe button in the bottom right hand side of your screen. The first question in the workbook asks you to define duty of care and gives you a list of words to use in your answer. I've provided a sample answer here, although you will need to provide your own definition. Mine is, duty of care is a legal and moral obligation and responsibility of a care worker to ensure the safety and well-being of the individuals that they care for. In other words, simply by being an employed care worker, you have a responsibility for the health, safety and well-being of the individuals that you support. It is important to understand that duty of care in your day-to-day work is not black and white. There will always be grey areas, and you will have to use your judgment to ascertain the best course of action. This will be examined more thoroughly in the next slide when we discuss dilemmas. However, the knowledge that you will use to base your judgments will come from several sources. Your job description will outline your duties and responsibilities, and the Adult Social Care Worker Code of Conduct, which can be found on the Skills for Care website, provides guidelines for best practice and professional behaviour. Your organisation's policies and procedures will provide you with information about how to work safely and within the law. You should also be aware that it is your responsibility to report any unsafe or abusive practices to safeguard the individuals that you support. The next question asks you to describe two dilemmas between keeping an individual safe and promoting their rights to choice. For example, a substance user's right to choose to use drugs despite significant risk to their health, or an individual spending their money frivolously and not having enough left for their living essentials. You'll probably have experienced many such dilemmas in your work setting and will be able to think of your own. In the next slide, we look at what you should and should not do to promote the individual's choices whilst also fulfilling your duty of care. For the example with an individual refusing to wash and consequently having poor hygiene that poses a health risk, you should prompt them to wash and help them to understand why it is important. Perhaps you may discuss the reasons that they do not want to keep clean, or get support from your manager or an occupational therapist. However, you should not try to force the individual to wash or use restrictive practices. For the example with an individual spending all their money on their girlfriend and not having anything left for necessities such as food, you should offer to help them to budget better and advise them on the repercussions of not being able to afford the things they need to live. Perhaps help them to put a system in place to manage their money better. You may need to obtain support from others such as your manager, co-workers or other health and social care professionals. You should not withhold their money or tell them what they can or cannot spend their money on. Obviously, some situations may be different. For example, if an individual has a deprivation of liberty safeguard or DOLS, or has a mental capacity assessment and has been deemed not to have the capacity to make certain decisions for themselves, then you will follow that individual's care plan. However, if you do not have the paperwork, you should always assume that an individual has full capacity to make their own decisions. If you are in doubt of their capacity and they have not yet had an assessment, you may decide to refer them to a health and social care professional so that they can be assessed. I always find that the most useful thing to remember regarding duty of care and any other decision-making process is to ask myself that in a worst-case scenario, would I be able to justify my decision to others? Activity 3.3b looks at comments, concerns and compliments and asks where you would go for support in the listed scenarios. The first scenario involves individuals informing you that they believe their medical records have been tampered with. This should be reported to your manager immediately so that they can conduct an investigation. The individual should also be given the opportunity to make a formal complaint using the complaints procedure. Next, you require further guidance about part of the complaints procedure. Again, you could ask your manager or perhaps the registered manager to clarify things for you. Finally, an individual would like to make a complaint about the meals. You could ask them to provide you with more information, and if it is a quick fix, you may be able to resolve it yourself and appease them. The individual should still be afforded every opportunity to make a formal complaint if they wish, and you should let your manager know. The next question looks at the importance of having a robust comments and complaints procedure and asks how this can be used to improve the services delivered. First and foremost, it will help you to identify any issues with your service or practice. This could be something that you were not aware of and would never have known about had it not been raised, and it gives you the opportunity to adjust and improve practice. Conversely, you may be informed that an individual, their family, or another health professional has praised your work, and this can help you to feel valued and improve your morale. Finally, it is a legal requirement for care organisations to have a swift and accessible complaints procedure. There is also duty of candour, which means that when mistakes are made, the organisation must be upfront and transparent about what has happened and try not to hide it. They should apologise to those affected and either fix the mistake or support them to manage the consequences. The next question asks, what are adverse events, errors, near misses, and incidents? An adverse event is an unintended or unexpected event as a result of an action or inaction. An error is something that was performed incorrectly or not at all. A near miss is something that could have caused harm but was narrowly avoided. And an incident is an unplanned negative event that causes harm or damage to property. This question also asks you to fill in a table consisting of a number of scenarios. Unfortunately, there's not enough room in the slide to show this, but if you click the link in the description below, you can see a copy of the table filled out fully, as well as more in-depth answers to all the questions in the workbook. The next question asks which legislation and agreed ways of working would need to be considered when reporting adverse events, errors, near misses, and incidents. Some examples are the Health and Safety at Work Act 1974, Management of Health and Safety Regulations 1999, Reporting of Injuries, Disease and Dangerous Occurrences RIDDOR Regulations 2013, and an accident book or accident procedure. This is by no means a comprehensive list. Activity 3.5a asks you to think about some situations that may result in a confrontation. There's 5 listed here, but I would encourage you to use this as a guide and think up your own. The final question asks you to pick one of your difficult situations from the previous section and answer questions about it. I chose the example of an individual with paranoid schizophrenia experiencing hallucinations and believing that their staff are making fun of them. Confrontation could be avoided by communicating with the individual to reassure them that what they think is not the case and that staff are definitely not making fun of them. You could remind them that they have had similar hallucinations before. You would assess and reduce the potential risk by using knowledge about the individual from their care plan and your experience from working with them. You would approach the issue calmly and ask if they would like to move to a quiet room to talk. You may even offer them PRM medication in line with their care plan. Confrontations are recorded slightly differently between organisations. You may have a paper system or a digital system and may use an incident form to document it or an ABC chart. You're going to have to check with your own organisation how this is recorded. You would usually report it to your manager as well. And that's the last question for Standard 3 Duty of Care. Thank you for watching. I hope you find it useful. If you require any additional help or want to send feedback about this video, please feel free to use the comment section below or visit my website dsdweb.co.uk. The link in the description will take you to more detailed answers for this standard. And if you haven't already done so, please click the like and subscribe buttons below. By doing so, you'll be the first to know about any new videos that I create. Thank you for watching, and bye for now.